Hi, I'm Arnold Cabasso, psychologist at Joannio, and I'm here with my colleague Chuck Mastro, who was at Joannio. He's at BCA, I'm sorry. Okay, Chuck?
Former Joannio employee. I currently work for Clarkstown School District. I'm a board-certified behavior analyst and also a licensed behavior analyst in the state of New York.
Okay.
All right, so we're going to talk about a little bit about behavior planning today. So when do we consider using behavioral techniques? A few things to consider. When there is some distress to the individual, when they are causing distress to the others around them, when whatever they're doing interferes with ordinary activities, when it interferes with their ability to learn skills or make connections with others around them, then we call it a challenging behavior. When any of these things are occurring, we start to look at the behavior, and that's when the discussion begins of what we should do about it.
The first thing we do is called a functional behavior analysis, or sometimes we use an ABC chart, and I'll get to what the A, B, and C stand for. Functional analysis of behavior is an examination of why the behavior occurs and what motivates it. It could be something before, which is an antecedent. For instance, a person sees they're getting closer to the dentist's office and get agitated, or at the holidays, a child without family gets upset watching everyone else open their gifts. It could be for what happens after, and that's the consequence. The B, of course, is behavior. Some individuals like attention, some want to be left alone. We need to know that. Are they looking for a toy or a parent's attention? In some instances, it could also be that the behavior itself is perpetuating the behavior, such as seeking sensory needs. These can be mouthing on objects or toys, biting, self-injury, or pulling hair. With this information, we can begin to work with the child and the family to eliminate the problem behaviors. Also, doing this formally, for instance, using an ABC chart, alerts us to exactly what we're looking for, so that people don't say things like, well, it just happened out of the blue. It allows us to think more carefully about what we're seeing first so that we're aware of it.
So, what are the behaviors that we're going to target? So basically, what we do is we judge it on several factors. After a short introductory paragraph in a formal plan, we give a brief description of the individual. We list the target behaviors. They must be in quantifiable terms. So in other words, we can't say, they were having a tantrum, or he has to be good. Okay, what does good look like? What does a tantrum look like? So we could say we're targeting a tantrum, which presents as him throwing himself on the floor, kicking and screaming, throwing objects. It has to be something that it leaves any of the guesswork out of it. The reason for that is it allows us to better judge whether the behavior is getting better or worse. When you're able to do it in those quantifiable terms, you're able to look at it a lot more objectively. And we're trying to do this as objectively as possible. So a bad example would be annoying, stubborn, difficult. So better examples include hits, bites, elopes, refuses to go to the program or take medication. So these behaviors should be of significance of the child, their development, such as being able to tolerate grooming routines, expanding their tolerances for healthy foods, and the ability to be told no. Some examples that should not be included can include things such as, I want my son to watch baseball with me, or I want my daughter to be interested in wearing makeup. I have extensive experience working both at home, in schools, with people in all different settings. And what we really want to do is focus on what is best for the child that we're dealing with, not so much what is the preference, okay? The reason for that is, we're dealing with a bit of ethics, and we're also dealing with quality of life. I have two daughters. I would love nothing more for them to sit on my lap and watch the Giants football game with me on Sunday. They have no interest in it. And it would be wrong of me to try to push that on them. However, if one of my daughters isn't eating vegetables, that has something to do with her health. When all she wants to do is eat candy, and I just came from there, and all she wanted to do is eat candy and wanted none of the vegetables I made her. These are things that we're going to start to work on. Now, obviously, these are very mild examples, but when we're dealing with target behaviors, we can deal with something such as a very restricted diet. Does the child only want to eat bagels and chips and one particular brand of macaroni and cheese. That's when health comes into factors. And yes, it would be easier if they ate what the family was eating, but we also have to look at what's healthy for this child. They should be getting fruits, vegetables, meats, all the food groups in order to help them to grow.
But, by coincidence, Chuck, I was just interviewing a father and a son, and I asked whether the son engages in conversations in a normal way. And he said, well, not really. When I'm criticizing him, he doesn't want to listen to it. He tries to cut the conversation short. I said, well, who wouldn't? I said, if I get called to the director's office, I want to get out of there too. Okay.
Some is just self-preservation.
That's right. So contextual factors, medications and psychiatric diagnoses. Contextual factors can include environment, noise level, time of the month, before meals, presence or absence of a family member. These are things we need to know so that we know how, if we need to possibly manipulate them in some way so that the behavior doesn't occur. Some people do very badly in crowded environments. A lot of the people that we work with do, and that's one of the reasons why the group home movement was more successful than when they were previously in institutions. Psychiatric diagnoses can affect behavior significantly. ADD, or attention deficit disorder, or attention deficit with hyperactivity disorder can affect behavior. Oppositional defiance disorder, which is by definition something that could cause aggression, or generalized anxiety disorder, which can cause escape behavior, are all examples. Some psychiatric diagnoses can be symptomatic but don't affect behavior, and an example of that could be depression, which is a bona fide psychiatric disorder, but there may not be any behaviors at all. We tend not to work on that, although they may get medication, or we will try some things to alleviate some of the depression, like getting them to be more active.
Just to touch on, the other things, especially when you're dealing with children, when they become adolescents, everyone has gone through adolescence. That hormonal shift, even though they're not hitting the same milestones as their neurotypical peers, especially when they have, autism or some of the more severe disabilities, they're still going through that hormonal change. And it impacts them the same way. Boys, again, when they're starting anywhere from the ages of 17 to 19, also go through a testosterone boost. These are hormone levels that really can impact their behavior, can impact their thinking, can make them a little bit more erratic. Depending on the child, it presents itself in different ways. But these are all contextual factors that should always be kept in mind as well. Where are they developmentally? So. The proactive strategies. Basically, what you want to do is try to come up with interventions before the behavior happens. You want to be proactive. So based on the results of the functional analysis, what methods will be used to mitigate behaviors? This is dependent on the result and dictated by the function of the behavior. For example, if a child is having a tantrum because they do not want to clean their room, the demand should be held in place. If they're having a tantrum because they want attention, this should be ignored while they are taught better methods for soliciting attention. So, the example I always use is that kid that's in the store and they're passing the candy aisle. If they're throwing a tantrum because they want candy, the last thing you should do is give them candy. Okay? Every time they pass the candy aisle, you're going to get the same tantrum. However, it's really important to know the function of the behavior, because if they're throwing a tantrum, could be the same place in that same candy aisle, but they want mom or dad's attention or your attention, whatever your relationship is, and you say, no, you can't have the candy, but it's okay, and you pick them up and you hug them, guess what? Those tantrums are going to happen. So that's why it's really important to get the function of the behavior. By being proactive, you know what interventions you could put into place and say, give them the attention prior to even getting to the candy aisle. If that's the function of the behavior, make them elicit the attention in an appropriate way. So the behaviors look the same, but the functions are different, so the intervention should be different. Avoid changes in the schedule, or if changes must occur, give lots of preparation. Identify and recognize triggers. If they could be avoided, such as loud noises or song, try to minimize this. If it cannot, such as bath time, work on desensitizing them and utilizing reinforcement to assist in making it less aversive. So again, it all goes back to what is best for the child, and that is what's always going to be paramount in this process. If they hate loud noises, but you live next to you live in a very noisy apartment, we have to be able to desensitize them a bit to that. The more they could get used to those noises, the more we could integrate them into society, the more they could be, integrated and self-sufficient. With that being said, I have a student, he hates Baby Shark. I can relate. But that's something that we really don't have to desensitize them to. We teach them other methods. Put on your headphones, listen to something you like more, walk away, go to another room. Ask appropriately to be removed from the situation. So, those are two examples where one you should really desensitize and one you could actually teach them to avoid. But, if you do it proactively, you do it before the behavior even starts, and that's our goal.
Okay. Another methodology is teaching alternate behaviors. This can include chores or other activities that give the individual more chances for reinforcement. It's also a way to get them to stop doing what they were doing because they don't want to do the chores. We had people who didn't want to go to the day program, so we gave them some housework to do, which they found even more unpleasant. Even though the day programs we thought were pretty enjoyable, they definitely did not want to do housework. With lower functioning individuals, this could mean behaviors incompatible with a maladaptive behavior. For example, giving an object to play with, to hold, for someone who mouths their clothing can be a successful strategy. This is also the opportunity to teach more appropriate means of achieving the desired results, such as being able to request a break, ask for desired items, or solicit attention appropriately. We want them to ask for things rather than to act out to get those things. So you may hear people say things like, use your words, so that people behave in an appropriate way to ask for things rather than have a tantrum to get those things, or what a baby does is cry.
So reactive strategies, and in a perfect world we wouldn't have to use them, but in that world I would also be out of a job, so it's kind of a double-edged sword. Sometimes you have to be reactive. It's not realistic to think that you could stop every form of behavior. So what should we do when we have to be reactive? Discuss with the individual what could have avoided the situation. All right, you always want to make it a teachable thing when you had to be reactive. If they are not of the cognition where you can discuss this, that's when you have to be a little bit more, direct with the teaching and actually show them what the replacement behavior would be. Redirection by talking about something of interest to the individual. State what they should be doing instead of what they should not be doing, such as, I need you to calm down instead of stop yelling at me. A lot of times when they're in that moment, they need the appropriate response. Planned ignoring, that's not commenting on the behavior, and that's particularly effective if it's just solely for attention. And then lastly, use your words. All of them have some form of communication. Some of it's more primitive. So obviously someone that might be nonverbal, you're not going to say use your words to, but are they using some type of assisted communication system like Proloquo? Are they using signs? Are they able to kind of point? Even my daughter is 2 years old. She's still developing language. When she gets frustrated because I don't understand her, I go, show me what you want. I have her show me. Okay, this stops her from crying, and it's an effective replacement behavior. The same thing goes with the individuals we use. We have to teach them to communicate in more effective means. The strategy used should be based on the function of the behavior. Sometimes we kind of have to triage it. We don't know the function when it's happening in the moment, but that's when really getting if this is your son or your daughter or your student, you have a good relationship with them, you have a good understanding of them. The more you can kind of focus on not so much what the behavior looks like, how it makes you feel, but why are they doing what they're doing, the easier it's going to be to come up with an effective solution for it.
Yeah, we can't emphasize enough that we have to look at the individual, the function of their own behavior. Somebody once asked me, what do you do when somebody's self-injurious or self-abusive? And I said, there's not one reason somebody might do that. They might do it for opposite reasons, two different people. I had two different individuals, two females, who would self-abuse for completely opposite reasons. One wanted attention, the other one wanted to be left alone. I developed a completely different methodology. Another, some of the reactive strategies we use don't have to sound like we're doing something physical to them. We have one individual who lives at our agency who has borderline personality disorder, and she likes to create emergencies. At the end of the program day, she would just say, I'm not going. And of course, there was no way she was going to stay overnight in the day program. So we realized that what she wanted was to create some turmoil. So what I advised, and the staff, of course, were very upset that they would have to stay there overnight or miss dinner or whatever. And I said, that's not going to happen. Just turn off most of the lights, leave it a little dim, and sit there looking at your phone and don't talk to her, because that's just what she wants. She got bored and said, I'm ready to go. Okay, reinforcers. Reinforcers are things that enhance or encourage positive behaviors. There are also negative reinforcers, but we're not going to talk about that. So as I'm sure everyone knows, even if you like your job, you come for the paycheck. Know your person. It could be socializing or avoiding people, which is something I just mentioned. Try to avoid food reinforcers. It's something that people think of initially. These are powerful reinforcers, but often foster unhealthy habits. Some good examples for home use could be screen time, watching TV, or something else, but try and keep it limited. Parental attention, preferred access to a toy or a new toy. Let me tell you a little story since Chuck's talking about his daughter. When my son was about 3 years old, I came home from work and he was playing with a new truck. And I knew right away what happened. My wife gave it to him because he did something right or he learned something. So I said, Glenn, who gave you the truck? And he said, Mommy. And I said, why did she give it to you? And he said, she's having a good mood. True story. I wanted to reinforce, I had to tell him it's because you did whatever it was right. And also, depending on the understanding, tokens can also be used, which can be exchanged for reinforcers as well. And that's a terrific strategy because you don't have to deal with reinforcers that everyone gets the same thing. People can exchange them at some later time for what they want, let's say an outing or something else, or looking at certain things, or attention to staff. And also they take on their own reinforcement. It's kind of like star charts in the younger grades. They want those stars even though it doesn't mean anything. It takes on its own reinforcement.
So crisis intervention, de-escalation techniques. Again, as Arnie pointed out, there's no one way to do this. It's going to be very dependent on the situation, where you are, who is around, how severe the situation is. All of those things come into play. If you're at home with both parents and you have a 5-year-old that is kicking and screaming on the floor, it's very manageable, and you might be able to do one technique. You put that same situation, you're by yourself, say in the Palisades Mall in the middle of shopping season right now, the de-escalation techniques are going to look a little different because of the severity of it. But a couple good general rules. Don't get into someone's face, okay? The reason you don't want to do that is you're putting yourself in danger, and you're also giving them a bit of fight or flight with it. Now, a lot of times what happens is, especially with younger children, they pick flight, and it works for a while. The reason I always say to be wary of this method, they're going to get older, and it's going to become less and less effective as they get older. And I've been called in quite a few times with 13, 14, 15-year-olds that were managed this way for years and years and years, and now all of a sudden those 13, 14, 15-year-olds, men and women, have become aggressive, and it is a lot harder to deal with them because that flight turns into fight. So don't touch unless given permission. This is especially good for teachers, but even sometimes parents. Some of the kids are, they do have sensory issues, and so if they're in crisis, even if they're used to it, and you touch them, it can cause a different reaction. you always want to speak calmly. A good rule of thumb, the louder they're speaking, the softer I typically try to speak. What it does is when they're screaming, they're still trying to communicate. And if I'm talking at a very low level, they now have to bring their level down just to hear what I'm saying. That's especially effective to just kind of calm the situation. Don't challenge. The second you get into a power struggle, I mostly feel that's the second you typically win. You want to downplay the challenge and just focus on the behavior. Listen, don't argue. A lot of times they are irrational, but you have to at least validate the feelings a bit. Move slowly and announce your movement. Again, they're in a heightened crisis state. You want to make sure that they are calm, and you don't want to do anything to kind of exacerbate this situation. Don't stare. My daughter, she's famous for this. Like, if she's crying and I'm trying to figure out and I'm looking at her, stop looking at me. You're going to make them self-conscious. So it's okay to look at them. It's okay to make some eye contact, but be wary of staring. And then, the last thing I would say, and this is the hardest thing, don't take it personally. Focus on the behavior and not the feelings that they're eliciting, because the behaviors, like we said, all have functions, and that's why we're trying to get to the function of the behavior. It's not personal against you. And typically what I find, especially in the home situation and even in the school with teachers, the people that they love the most get to see the most of the behaviors. So if anything, I know it's hard when you're dealing with it, but keep that in mind, that it's actually because of their comfort with you is a big part of why you're seeing these behaviors.
Okay, data and progress notes. We need to know when plans are working, so we track every day if the behavior is occurring or not. I know that sounds a little tedious, but sometimes you don't see a trend unless you track it. We might have feelings, or we happen to be there on a day when something happens, so it looks worse. But if we're tracking it, with data sheets, then we really know. Anecdotal information may be misleading, so it's best to actually track the occurrence to look at trends. When dealing day in and day out with issues, it's often necessary in order to be objective and unbiased. In our area, we write a progress note, so it forces us to tally up or down what the behavior is looking for, and that encourages us to keep data and to examine it and add it up.
Yeah, I've worked in a lot of homes, and it sounds kind of weird, because you're professionals, you're like, I'm not going to take data in my own home. What I find happens, especially when I'm working with families, and teachers are already trained to do this. So if you're in a school setting, and you're working with any type of IEP, everything has to be data driven. But in the homes, what I would find is we would see a behavior 2, 3, 4 times a week, and then we would start to work on that behavior, and it would get a lot better. And then we wouldn't see it for 2, 3 weeks, and then the parents would come to me and went, we have to change something. They had 3 behaviors last week. What I want to point out at that point is we had 3 behaviors last week, but we also had 3 behaviors in 4 weeks, as opposed to 3 or 4 a week. Let's see if this trend continues. But a lot of times what happens is, because when you're dealing with it, it's very hard to be objective. You want that quick fix because it's disruptive, and we're sensitive to that. But if you have a method that's working, sometimes what happens, the behavior will come back a little bit, short term. If you immediately change the intervention, especially an effective one, what that teaches the child is they have a method that stops this. As long as I continue the behavior, they'll stop doing it. And so it's really important to look at this objectively. And that's why it's really important, I feel, to track the behavior. As a BCBA, that's at the root of what I do. But just seeing the trend in working in homes, I feel is very important to take away a lot of those emotional decisions.
Mm-hmm. That's the end of our presentation.